Hello, this is Dr. Narjust I'm an assistant professor and a thoracic oncologist at the University of Wisconsin in Madison, United States. I specialize in women with lung cancer, not only the diagnosis, but also screening, treatment, and survivorship issues that are unique to women with lung cancer. I'm taking a few minutes of your time to request a call for action to treat and see all women with lung cancer. Data in 2018 revealed that for the first time in history, young women are getting lung cancer more often than men. These findings come from the paper of Jamal et al. In the New England Journal of Medicine. They found that the incidence of these young women between ages of 30 to 49 years of age was now higher than men. This data comes from Cancer Registry from 1995 through 2014. This reversal of the trend does not account for smoking behaviors. We are seeing more and more cases of lung cancer in women that never smoke. 2/3 of the lung cancer and never smokers are women. The female to male incidence ratio between whites of age of 40 to 44 increased from 0.88 to 1.17, meaning that the incidence in young women has surpassed men for the first time in history. The data was eye-opening for many people, but unfortunately has stayed in the little box in which it's not discussed often. One of the aspects of lung cancer in women is lung cancer screening is extremely important. The Nelson trial, unfortunately, only included 16% of women in the trial, but the women show a more benefit for the lung cancer screening for lung cancer mortality. And you can see it here, in which was a 26% lung cancer mortality decrease in men versus a 39 versus 61% in women. The trend was significant up to year 8, and then don't become significant a year 10 because the small percentage of women that were not included in the study. The Nelson trial had the hope of understanding the value of lung cancer screening in smokers, and an epidemiologic study determined that men are more likely to smoke, which is true, but does not justify why only 16% of women were included in the Nelson trial. Now that we know that lung cancer screening improves lung cancer mortality, we also have encountered that women are less likely to be screened for lung cancer, despite the data showing the benefit and the larger benefit in women. One include aspect of lung cancer, knowing that 2/3 of the lung cancer in women happens, 2/3 of the patients that never smoke are women, is that tobacco exposure came a little bit later for our women in the United States. In the 1960s and 1970s, the tobacco companies changed their marketing to target all women because the percentage were so low of the women that were smoking at that time. Smoking was portrayed as a sign of independence. It was at the same time that women were asking for equal pay. Well, we're still asking for equal pay, but that we're increasing awareness of equal pay to have a place in the workplace. So smoking was featured as a way to lose weight, a way of independence. And those still stay in our patients' minds today. When I talk to my patients about smoking cessation, their main issue is that they are fear of gaining weight. Another aspect of smoking in women is in developing countries in which they're the primary caregivers and also the primary cooks. So they get exposed to biomass smoke in hours, years, that produces lung cancer in these women that don't have the resources to smoke, because the women are most likely to spend the time in the stoves cooking and being exposed. Lung cancer survivorship in women is different. It goes from sexual health to social challenges that are unique to women. Women are more likely to be the primary child care for their children or for their grandchildren compared to men. They also are the primary caregiver for elderly, for their parents. And finally, there's an aspect of financial toxicity that affects women, as many of them have joined the workplace. So this is a call to action to understand that lung cancer in women is different. It's different, and the incidence increasing is different about having a larger number of patients that never smoke. Also, women are most likely to have side effects to therapy compared to men. They live longer than men, but we need to make sure that those women also have support through the phase of lung cancer survivorship. So I'm very thankful for VJOncology to give me the opportunity to share with you only a few aspects of why lung cancer in women is different.